Okay, today we're gonna pick up our previous lectures on psychological theory. This is a continuation of the behavioral science course we're following. Uh, in the previous lecture, we talked about psychoanalytic theory, which is one of the most famous theories in psychology, but perhaps it's not the one that has had the greatest impact when it comes to the importance in the history of psychology. Behaviorist theory and learning theory are much more important when it comes to physicians and to psychologists in general. So today we'll pick up learning theory. And keep in mind that you as physicians, you will also play a role as educators. I mean, one of your duties as physicians is to provide health care to people, but in order to do that, patients need to comply and patients need to follow treatment and they need to change their lifestyle and they need to modify their behavior. And how do you get patients to do that? Well, by educating them. Now, education is not just about giving out facts, but it's also about changing habits. Remember when we talked in the first lecture about ethics, we learned that Plato said that those people that do not behave well is because they don't know what they're doing. And Aristotle criticized that, and they say, well, look, behaving well is not just about knowing facts, it's also about having the will to do things and about having habits. And I think physicians would side much more with Aristotle on this. And in order to change people's habits, you need to know some basics of learning theory. How do people learn in order to persuade them to change their behaviors? So keep in mind that you as physicians are educators and that I mean, you're not educators as teachers or professors, so maybe you need to know the basics of how people learn facts or how memory works and all of that. But you do have to learn how to what techniques you must use in order to change a patient's behavior. Because remember, as we learned in the doctor-patient relationship and the lecture on the doctor-patient relationship, um, there is a risk always in the doctor-patient relationship that the patient will not comply. So by learning the basics of learning theory, you can increase the chances of the patient complying. Remember, also keep in mind that all of these topics will probably appear in the USMLE Step 1. So at the end of this lecture, we'll do some review questions with questions that resemble the ones that appear in the USMLE Step 1. So let's begin. So let's consider what learning is. Well, learning is the acquisition of new behavior patterns. And we're defining here learning in a broader sense. I mean, people may think that learning is just about getting facts and memorizing them or understanding them and analyzing situations and so on. And certainly that's a part of learning, but that's the cognitive aspect of learning. But you as physicians are more concerned with the behavioral aspect of learning. So here we're more concerned with learning as the acquisition of new behavior patterns, not so much as the acquisition of cognitive information. And the theory that works with this the most is behaviorist theory. As the name implies, behaviorist theory places a lot of emphasis on how people behave and how they change their behaviors. Nowadays, some people give it behaviorism a bad name. Probably you've seen in the movies how some behavior psychologists assume that people are machines or that they are animals, and that they can modify people's behavior with sticks and carrots, and that they treat people as if people were animals in an experiment and so on. But those are media stereotypes. I mean, it is true that some of the criticisms leveled against behaviorism, they are fair, but nevertheless, behavior theory is basic in psychology, and it has had a great impact in the history of psychology, and it is very useful for learning theory. So I think it deserves to be considered here, and I invite you to consider the importance of behaviorism with an open mind. So behaviorism begins with what's called a black box theory of mind. And this theory tells us that we can only observe behaviors. We don't really know what's going on inside other people's mind. And that's why it's called a black box. I mean, it's a mystery. I'm not in your mind to see whether or not you're enjoying this lecture. However, I can observe your facial expressions, and from that observation, I can make the inference of whether or not you're actually enjoying this lecture. It would be nice to read other people's thoughts, but so far we don't have the technology, and I'm not sure that we'll ever have the technology to do so. So behaviorists say that, well, look, mental processes are really of no concern to psychology. Psychology should be exclusively concerned with behavioral expressions, because if we try to gather what's going on inside the minds beyond behavior, that's speculation, because we really have no way of knowing. So we should be concerned exclusively with behavior, and that's what's called the black box theory of mind. It's a black box because it's a mystery. We don't know what's inside. Some psychologists have criticized this, and they have said that, well, even if we can never be sure what's going on inside other people's mind, cognition, or the process of the processing of thought, is important. So psychology is not just about behavior, it's also about what people think, even if we may not be absolutely sure of what's going on inside other people's mind. So that's one of the first criticisms that has been leveled against behaviorism. But for the time being, let's keep up with the assumption of the black box theory of mind of behaviorism. So let's consider behaviorism where it all began. And it began with a series of very famous experiments by a very famous Russian scientist, Pavlov. And I'm sure that you've heard of this in the media, because the phrase Pavlovian dogs is quite popular. A Pavlovian dog refers to someone or to a situation where people respond automatically or mechanically to a stimulus. So a Pavlovian dog is pretty much like a machine that receives inputs or receives stimuli and gives outputs or gives responses. And this goes all back to a series of very famous experiments that this Russian scientist did. So Pavlov was a Russian scientist that he wanted to study the digestive system of dogs, and he was very interested in salivation. As you probably know, salivation has an important physiological function in as much as it prepares the digestive system with all the chemicals needed in order to process the food that's going to be taken in. So salivation produces enzymes, and the enzymes will eventually break down the food so that it's processed through the digestive system. So every time an animal sees some piece of food, the animal will start salivating. And Pavlov wanted to study how these processes took place. But in the midst of doing these experiments and doing these studies, he realized something very interesting, and he came to see that the dogs he was studying salivated at the sight of their keeper, not at the sight of food, but at the sight of their keeper. So they salivated in the absence of actual food. So Pavlov began to wonder, how can dogs salivate if they are not seeing food? And he began to think that, well, maybe it is that they're seeing not the food, but something that is associated with the food. And by making that association, they can eventually respond to a different stimulus that was originally associated with the original stimulus. So he devised a new way to perform a new experiment. He said, well, look, every time a dog will be provided with food, we're going to make sure that we ring a bell, and we'll see what happens. So during this series of experiments, Pavlov provided the dogs with food, but immediately as he was providing the dogs with food, he would ring a bell. Now eventually he came to realize that the dogs salivated as a response to the bell even without a food. So it came a time after a series of trials that Pavlov would only ring a bell and the dogs would salivate even in the absence of food. So this was a very interesting result. So this process was eventually called classical or associative conditioning. So the dog is conditioned through this experience to salivate not at the sight of food, but at the hearing of a bell. Now, it's not natural for a dog to do that. I mean, if you take street dogs and you ring a bell, they will not salivate. But if you take those dogs and you provide them food for a number of trials, and every time you give them food, you ring the bell, eventually the dog will be conditioned to salivate at the sound of the bell and even in the absence of food. Now, this is called conditioning because it's not a natural response, but you can condition the dog to do that. So classical conditioning arises not as a result of consequences, but merely due to association. So in conditioning, there's the unconditioned stimulus, and in that case it is food. I mean, it is natural for people to salivate when they're presented, or people or animals, it is natural for them to salivate when they're presented with food. That is the unconditioned stimulus. The unconditioned response, well, again, is the saliva as a response to the food. That's unconditioned, that's natural. However, you can modify the behavior, and that would be conditioning. So the conditioned stimulus is the bell. If you associate the bell with the unconditioned stimulus, which in this case is the food, for a given period of time, and after doing this many times, then that stimulus will be conditioned. And the response will also be conditioned. So the dog will begin salivating, not to the food, but to the bell. There will be a conditioned response. It is conditioned because it is not natural for the dog to do that, but you can condition the dog to do that. So in this process of classical conditioning, and we call it classical conditioning because later on we will see a difference with operant conditioning, which is similar, but there are some differences. In this process of classical conditioning, there is what's called response acquisition, extinction, and stimulus generalization. So acquisition happens when the conditioned response is learned. So when the dog begins salivating after hearing a bell, that's acquisition. So the dog acquisition or received or got the conditioned behavior of responding to a conditioned stimulus, which in this case it's the bell. Now this has to be consistently done, because if it is not done consistently, then eventually the behavior will go back to the unconditional stimulus and the unconditional response, and the behavior will become extinct. So extinction is when the conditioned response decreases if the conditioned stimulus is never used again. So let's say that you have the dogs and you give them food and you ring the bell many times and you condition the dog to salivate every time the dog hears the bell. Now, if you stop making that association for some given time between the food and the bell, well, eventually the response, the salivating response to the bell, will eventually become extinct. So, and that's what extinction is when the conditioned response decreases if the conditional stimulus is never used again. So a behavior will become extinct if it is not continuously reinforced. So if after a while you keep giving the dog food without ringing the bell, then after some period of time, when the dog hears the bell again, the dog will not salivate because that conditioned response has not been strengthened. And stimulus generalization is when a new stimulus that resembles a conditioned stimulus causes a conditioned response paired with the unconditional stimulus. So a stimulus generalization could be that, okay, the dog is provided with food, and every time the dog is provided with food, he hears a bell. Now, it may be that the dog is walking somewhere else, and he hears a siren, a police siren. That somehow sounds a little bit like a bell, but it's different. Well, the dog may have generalized the response to that stimulus, and by hearing the police siren, which resembles a little bit the bell, he may begin to salivate at the sound of that. So this may be stimulus generalization. In a medical setting, this is very important, especially for people with post-traumatic stress syndrome. I mean, If someone, I'm sorry, post-traumatic stress disorder. This is a disorder that is categorized in the DSM-5, and it's very common in war veterans. Now, the way this usually works is that war veterans go through some very traumatic experience. If during that traumatic experience there is another stimulus that is associated with the traumatic experience, when these veterans go home and they encounter that stimulus, their response, their stress response or their fear, may be a conditioned response to that stimulus because they have generalized it. So let's say that a war veteran receives a gunshot or hears an explosion and during the time that he hears an explosion, let's say that someone wearing a military helmet was right next to them. Well, it could be that when they come home and they see someone with a military helmet, their fear response, when they see the military helmet, they maybe that they have a response to that helmet. Now, even in the absence of the gunshot or the traumatic experience, they will still react fearfully to that because they have generalized the stimulus. And this is also relevant when it comes to substance abuse. People that have a drug dependency, they usually carve for drug consumption. And when we get to substance abuse disorders, we'll take a look at some of the withdrawal symptoms. And one of the withdrawal symptoms is, craving for the substance. So addiction treatment often focuses on the management of craving. And craving is triggered by cues, both external and internal, via the process of classical conditioning. So if you create the habit of taking cocaine, and every time you take cocaine, let's say that a given TV program is on, let's say at 7 o'clock at night, you watch Wheel of Fortune, and when you watch Wheel of Fortune, that's when you took cocaine. Well, when you withdraw from cocaine, if you watch Wheel of Fortune at 7 o'clock, watching that program may increase your craving because it will be triggered by cues. So your craving is a response to a stimulus that has been generalized. So the person encounters a reminder of drug use, and the association stimulates craving. So this is why understanding conditioning is very important in the treatment of substance abuse disorders. Okay, another concept that's related to conditioning and that's very important in psychiatry and the medical profession is learned helplessness. So this is an association between aversive stimuli and an inability to escape. And some people have said that this goes on a lot in depression. Patients are aversely stimulated, so the environment that doesn't stimulate them well, and their response is pretty much feeling depressed. And these patients come to feel that there is no way to escape from their discomfort. So eventually the organism gives up its will, and that's when learned helplessness comes in. So they begin to have the idea that they just can't get out of the bad situation they're in because they are stimulated by things that make them feel depressed, and eventually they generalize all that stimulation. They generalize that stimulus to every other stimulation, and eventually their response to every stimuli is just to feeling down and depressed. So that's learned helplessness. And so the organism eventually gives up its will to feel better, and eventually the organism comes to feel bad at all times. So this is something that psychological torturers know very well, and they use this tactic to demoralize the victims. So eventually they teach the organism to respond in a depressive manner to every sort of stimuli, and this is what in psychology is called learned helplessness, because you eventually, through a process of conditioning and modifying your behavior, you learn to be helpless and to assume that there's nothing that you can do in life, and it's a very difficult cycle to get out of. There are ways of breaking this vicious cycle, but it's pretty tough when it becomes firmly established, as this process of learned helplessness is consolidated. A similar process to conditioning is in imprinting, and this is the tendency of organisms to make an association with and then follow the first thing that they see after birth. This is quite common in animals. It's not so common in humans, but it might explain the universal repulsion to incest, and this is called the Westermarck effect. Incest is a little bit of a puzzle among evolutionary psychologists. I mean, why do we avoid having sex with people that are close to us? Freud used to think that the psychoanalysis and Freud used to think that this was due to the fact that culture taught the individual not to have sex with their relatives, and that this was actually a repression of the id. Remember from the previous lecture we talked about morality, which relies on the superego, and the id, which are the instinctual drives. And Freud argued that we all have instinctual drives for incest, and the superego comes in and represses that. But evolutionary psychologists, they don't usually tend to accept that hypothesis, and they actually think that the incest taboo, I mean the universal prohibition of having sex with relatives, might be actually a case of imprinting. So as soon as we're born, we are imprinted with those around us, especially our parents and our siblings, and we have an imprinting of sexual aversion. So those that we are raised with, either our parents or our siblings, we develop a natural tendency to feel disgusted when it comes to sexual feelings towards them. So that may be one of the few cases of imprinting in the human species. Imprinting is related to conditioning in the sense that behaviors are modeled. So they can be modeled either positively or negatively. And in the case of the incest taboo, well, they are modeled negatively in the sense that we develop an aversion towards those people that are around us when we are born and during our early infancies. Here's a picture of how imprinting works among animals. Here's a duck and all the ducklings. Usually what happens is that the first animal that the ducklings see when they come out of the eggs, they begin to follow and imitate their behavior, and they become attached to them. That's imprinting. Okay, along with behaviorism, there's also what was called Thorndike and the law of effect. Now, Edward Thorndike was an American psychologist, and he did some experiments that they reached some of the same conclusions as Pavlov. This was in the beginning of the 20th century. Thorndike placed some animals in mazes and taught them how to escape from there. Now, the way he taught them how to escape was by making some routes more difficult than others. And Thorndike came to realize that animals would choose the easier routes, and that was basically a response to stimulus. So those stimuli that presented difficult routes, well, the animals would eventually avoid them, and those stimuli that presented easier routes, the animals would choose them. So from this he derived two conclusions. He derived the conclusion of the law of effect, and that is that the effect of an action will determine the likelihood that it will be repeated. So if an action is pleasurable, so let's say that in the easy routes they were provided with food, so the animals will always choose those routes, and the animal will do it again. If an action is not pleasurable, then the animal will stop responding to that action. So this is the law of effect, and this is pretty much like using stick and carrots. Every time someone behaves well, you give them carrots, so you encourage them to do it again. If someone behaves bad, you hit them with a stick, so you encourage them not to do it again. This is pretty much the law of effect as Thorndike formulated it. And there is also the law of exercise, which according to Thorndike is that the strength of an association between a response and a stimulus will depend on the number of times that they have been paired. So if someone behaves well and you give him a carrot, you will not reinforce that behavior as much as if you give them 10 carrots every time they behave well. And the same goes for the opposite way. I mean, if someone does something bad, but you punish them mildly, that will not deter them from doing that again, as if you punish them severely. So that's Thorndike's law of exercise. A very similar experience to a very similar experiment to the ones that Thorndike presented was the experiment of Skinner and his rat. Now, Skinner put a rat in a maze, very much as Thorndike had done with other animals. And when the rat pressed the button, the rat got an electric shock. However, when the rat pulled a lever, it got food. So here we may be asked, what do you think that the rat ended up doing? So if on the one hand they press the button and they get electricity, and on the other hand the rat presses the lever and they get food, well, I mean, it doesn't really take a genius to figure out that eventually the rat will not press the button and will continuously pull the lever. And that's what actually happened. And here's a picture of the rat in the experiment. As you see, here's the lever. The rat pulls the lever, so every time the rat pulls the lever, it gets food. And over here is a button that every time the rat presses the button, a shock generator will send electricity and it will get an electric shock. So Skinner realized that after a few trials, the rat would never touch the button, but it would always pull the lever. And you know, this is a confirmation that a behavior can be conditioned, and that you can form a behavior with a different systems of stimuli. So this gave way to another concept in behaviorist theory that's called operant conditioning. Now, in operant conditioning, it's a little bit from classical conditioning. In operant conditioning, the behavior is determined by its consequences for the individual. So the consequence or reinforcement occurs immediately following a behavior. So this is a system of rewards and punishment. It's a little bit different from classical conditioning, because in classical conditioning, you're not really rewarding or punishing the subject, either the animal or the human being. In there, you're just changing their responses to different stimuli by generalizing stimuli. Over here, it's a little bit different. Over here, operant conditioning has the purpose of modifying behavior by using rewards and punishment. So the behavior is determined by its consequences for the individual, either punishment or rewards, and the consequence or reinforcement occurs immediately following a behavior. Whereas in classical conditioning, the stimuli happens before the behavior. Here it's the other way around. Here first there's a behavior, and then there is either a reward or a punishment. So there are basically 4 types of responses to a given behavior. You can either reinforce the behavior, or you can try to make the behavior disappear. Now you can reinforce a behavior by using positive stimuli. So that is basically giving a reward, an active reward. So for instance, if you participate in class, well, that's a good behavior, then you get the reward of getting good grades. So you get an additional thing. But there is also negative reinforcement, in the sense that your behavior is reinforced not by getting something, but by not getting something that you don't want. So for instance, if you do exercise or you go on a diet, you don't really get something, but you stop getting something that you don't want. And in this case, it's weight. So you go on a diet and you lose weight. Now it's negative because you're not getting something additional. Something is being subtracted from you, but that reinforces your behavior because that's what you want. Or for instance, let's go back to the case of class. If you participate in class, you get good grades. Well, you're getting something that's positive reinforcement. But it could be a negative reinforcement. If you avoid being late to class, I won't scold on you. So I will not give you something that you dislike. Well, in that case, it's negative, but it's a negative reinforcement because you enjoy not receiving that. So those are reinforcements. I mean, those are responses to your behavior that actually increase the odds that you will do that behavior again. Now, the other way around is either providing either punishment or extinguishing a behavior so that you will not do that behavior again. So in punishment, it's very much like positive reinforcement in the sense that you get something that you don't want. In positive reinforcement, you get something that you want. In punishment, you get something that you do not want. So, for instance, in the case of coming to class, well, if you get drunk before coming to class, I give you something bad. You are suspended. That's a punishment. But it can also be extinction. So, for instance, a student can harass a girl, but if the girl gives no response to that behavior, well, that behavior may eventually become extinct because the behavior is not being rewarded. So the absence of reward may eventually be an extinction stimulus. So this is different from punishment, because in punishment you're deliberately giving something nasty so you won't do something again. In extinction, it's not deliberately you giving something nasty or unpleasant, but rather not giving you something pleasant, not responding to your behavior, and not responding to your behavior, then eventually that behavior becomes extinct. Now, when reinforcing behavior, it is also important to keep in mind that the success of these techniques will also depend on the schedules. That is to say, on how frequent the response to the behavior is. So there are different rates on how frequent the response to the behavior is in order to create habits and reinforce the behavior. So first of all, there's the continuous rate. So this is that every time you do something, you get a reward. So in this case, the reinforcement is automatic and it's presented every time. And the effect on behavior is very fast. But it's not enduring if it fails because it's too mechanical. So if every time you come to class, I give you a cookie, well, if one day I come up here and you come to class and I don't give you a cookie, then the response or the reinforcement that I tried will eventually fail if I run out of cookies. So the continuous reinforcement has the danger of being too automatic, and in that case it will not endure if the reinforcement fails. It is too mechanical. Now it can also be a fixed ratio, and that is to say that it will be an stimulus after a number of responses. So if I say to you that every time after 5 class coming early, I give you a cookie, that's different from a continuous reinforcement. It is not that every time you come to class I will give you a cookie, but rather that every 5 times that you come, I will give you a cookie. This has the effect that it will be quite fast, but again, it's not all that efficient, because if eventually I stop giving you cookies for every time you come early to class, then that association will not be present and maybe your behavior will become extinct. Now, very much as a fixed ratio, there is also a fixed interval, and this is when the reinforcement is a stimulus after a set amount of time. In this case, the response rate increases when the stimulus approaches. So I give you cookies every 5 classes you come, for every 5 classes that you come in time. Well, in this case, the first few classes you will not come on time. But when the time approaches that I will give you the cookie, well, in those classes approaching that time, you will be more on time. So the response rate increases when the stimulus approaches. But again, this is not all that effective, because if the stimulus is taken away, then the behavior will eventually become extinct. Usually the more efficient way of doing this, but it takes a little bit more time to dig in, is what's called variable ratio. And this is when the reinforcement comes at unpredictable times. Now this is the most effective way of reinforcing, although it may take a longer time. So if I want to reinforce your behavior of coming early to class, well, let's say that I give you a cookie in the first class for having come early, and then I don't give you more cookies until the 7th class, and then I give you cookies again in the 23rd class. Now it's unpredictable. You're not sure when you're going to get the cookie for being early. But the fact that I have reinforced that behavior without following a specific pattern increases your chances that you will be early. If this, if this is, it takes a little bit longer to get in this habit, but it's more efficient because you don't know when it's coming. So you're always prepared to receive a cookie, and in that case, you always come early to class. And actually, this is the way casinos work. There have been a lot of studies on the psychology of casinos and the psychology of gambling. And a big question here is, why are casinos so appealing? I mean, why do people even become addicted to them? There are gambling addictions, and we will cover them when we take a look at the DSM-5 addiction disorders. Well, one of the findings in the psychological research that has been done on casinos is that they use a variable ratio, at least in the slotting machines. Playing poker, and that's a different matter. But in the slotting machines, they are programmed so that the person will win. Not every time they'll play, so they will, but instead they will follow the machines follow a variable ratio reinforcement. So when a person pulls the lever, maybe that time they will hit the jackpot, but it will not happen every time they hit the jackpot, nor will it happen every third or fourth time. It's unpredictable. It may happen the first time, it may happen the 27th time, it may happen the 58th time. Now that unpredictability in the long term has the effect of making people think that they always have a probability of winning, and there's always an expectation of a reward even if they don't get it. This is very different from continuous reinforcement, from fixed ratio, from fixed interval. So casinos use variable ratio, and this has the advantage of getting people to always expect a reward even if the reward is not coming. Now, unlike the other three rates, this takes a little bit longer to create the habit, but when it does create the habit is much stronger. So of course, positive reinforcements, they can be used for destructive things such as casinos. I mean, gambling is never good, but they can also be used for constructive things. And this is something that educators have to learn, that to create it habits in the short term for fast effects, well, continuous rate may be a good option. But if you want that habit to endure, then it's better to use variable ratios of positive reinforcement. Okay, another technique in behaviors theory is shaping and modeling. So shaping is rewarding closer and closer approximations of the wanted behavior until the correct behavior is achieved. So this is usually done, for instance, with therapeutic techniques when people want to change their behaviors. So let's say that the therapist wants the person to stop smoking, and there's actually a technique that we'll cover later on that's called token economy, that when there is a behavioral change, people receive either tokens or money or rewards or whatever. So let's say that you want the patient to stop smoking, but at first they wear nicotine patches or chew gum. Well, if they begin chewing gum and wearing nicotine patches instead of smoking, let's say that you give them $5. But is that the ideal thing? Well, no, you eventually want them to stop altogether, to neither smoke nor take nicotine patches. So you first give them $5 when they substitute the nicotine patch for the cigarette. But when they eventually take out the nicotine patch completely and they can go on living without either the nicotine patch or the smoke or the smoking the cigarettes, then you increase their reward and you give them $10. So this is called shaping. So it's rewarding closer and closer approximations of the wanted behavior until the correct behavior is achieved. And there's also modeling. And modeling is basically a type of observational learning, and this is also used in therapy. So if you want people to change their behavior, well, you present them with a model and you tell them, look, if you behave this way as this other person is behaving, you're going to get good rewards. So if you follow this model, it will be good for you. So this is a model to follow. And this is why, from a sociological point of view, role models are so important. I mean, if a society has good role models, then you can expect that the younger generations that look up to those role models will have a better behavior. And this is why some people are concerned with hip hop and heavy metal and other musical genres, who sometimes may not provide good behavior because they may good behavioral models, because these people that youngsters look up to, they may glamorize drug taking and pimping and very bad things, and it may eventually cause social and psychological problems. So it is important for people to have role models and good role models, because we all model our behaviors. Later on, we'll take a look at a famous behavior psychologist in a future lecture. His name was Bandura, and he was one of the ones who claimed, and he did a series of experiments showing how modeling is very, very important. Now, there are some critics of behaviorist psychologists, and we should cover them here quickly because we don't have much time, but let's give them some attention. Apart from behavioral psychologists, there was also another school of thought in psychology that was called Gestalt psychology. And Gestalt psychology basically claimed that the mind actively organizes information into a coherent whole. So this is not like for one stimulus you have one response, and that's basically the approach of behaviorism. In the cases of Gestalt psychology, the idea is that the mind actively organizes information into a coherent whole, and that behavior changes not necessarily by little pieces, but it could also change by taking into consideration the whole. So knowledge does not come from a collection of isolated bits of information, but rather the mind creates a whole out of the relationships between separate parts. And Gestalt psychologists were very much interested in optical illusions, because when you have optical illusions, our perceptions are more than just an exact copy of reality. In order to perceive the world, you have to put in context what you're perceiving. And that is why it's called Gestalt, which means the whole in German. So when you perceive something, in order to make sense of the image that you're perceiving, you have to place that in context with the other elements that are around. And by contrasting that with the context, you can make sense of what you're looking. So perceptions depend on other objects to make sense of the image. For instance, let's take a look at this image. Are these buttons or holes? Well, it's an illusion, and Gestalt theory always has always made the claim that you cannot see both. You either see buttons or holes. Now, how do you decide whether or not this is a button or a hole? Well, it will depend on how you place those images in the context of the surroundings. So if you take one image and you, depending on how you relate that image to the other images, you will either see a button or a hole. And from this idea, Gestalt psychologists derived a famous slogan in their theory, which is that the whole is greater than the sum of its parts. And when it comes to learning theory, this is also applied. So people learn by putting things in context. This is different from behaviorist theory, because in behaviorist theory, it's basically a system of trial and error. I mean, every time you do something, you get a reward. Every time there's a stimulus, there is a response. So according to behaviorist theory, learning goes on by little bits of pieces, little stimuli, little response, and that goes on. In Gestalt, it's different. In Gestalt, it's not a little piece of stimuli and a little piece of response, but rather it is a whole process that must be figured out. And this has great implications on what the Gestalt theorists call insight learning. There were some very famous experiments done by a psychologist. His name was Wolfgang Kohler. This was during the First World War or the Second World War. I don't remember well. He wanted to experiment. He wanted to do some experiments with apes. So he put some apes in a cage, very much as Skinner had done with the rat. But in the case of the rat, in the case of Skinner and the rat, all the rat had to do was press a button, to get an electric shock and pull the lever to get food. Here it was a little bit different. The experimenter put bananas that were out of reach of the apes. He put them up in the ceiling. So the apes tried to get the bananas, but they couldn't get the bananas. So they became very frustrated. Now, a behaviorist prediction would be that in as much as the apes tried to do something, they tried to reach the bananas and they couldn't get the bananas. Well, since they did not get a positive reinforcement, eventually the behavior would become extinct, because since they didn't get any rewards, well, the apes would lose interest in the bananas, and that behavior would be extinguished. But this is not what happened. The apes did not give up so easily. The apes solved the problem of getting the bananas by grabbing some boxes that were nearby and climbing on the boxes and getting the bananas. Now, what did this experiment prove? Well, the experiment proved that learning is taken as a whole, and that there is a greater cognitive process in order to process information. It's not just a response to a stimulus, as behaviorists claim. When people learn, it's not just an automatic process of responding to a stimulus. No, it's actually insight learning. It's getting the whole picture in order to achieve a given goal. And you as physicians should take this into account. When you explain the relevance of behavioral change to a patient, you could use sticks and carrots. I mean, that's the behaviorist approach. And it could be useful in many regards. But also, you should also take into account that for some people or for some situations, there should also be insight learning. I mean, the patient needs to understand the whole process. I mean, you can give tokens to a person that stops using cigarettes and wears a nicotine patch, and later on you can give them even more tokens if the patient stops using the nicotine patch and stops smoking and using nicotine patches altogether. That's the behaviorist approach. But on top of that, it could also be nice if you explain to the patient why it is relevant for them to stop smoking. So a cognitive process is also involved here. And a cognitive process is also relevant when it comes to learning. It's not just about responding to a specific stimulus. So getting the whole picture of why people should stop smoking is also an important aspect of learning, and this is called insight learning. It's getting the whole picture. Okay, so this wraps up our lecture of learning theory for today. So let's do a few USMLE Step 1 questions as a review. So let's begin with the first one. A 4-year-old child who has received beatings in the past from which he could not escape appears unresponsive and no longer tries to escape new beatings. This behavior by the child is an example of A, stimulus generalization, B, modeling, C, shaping, D, imprinting, or E, learned helplessness. Well, I think the right answer here is learned helplessness. This is when people receive people eventually appear that in an uncomfortable situation there is no way to escape, and they just come to assimilate that they're helpless and that there is nothing they can do about it. And this is a model frequently used in depression. People feel depressed, and no matter what good stimuli they receive, they will not respond positively to that because the previous stimuli have been so devastating that they eventually accommodate their behavior to be helpless all the time. So it's E, learned helplessness. Okay, let's take a look at another question. A 7-year-old child who likes and looks up to her physician states that she wants to become a doctor when she grows up. So this behavior by the child is an example of A, stimulus generalization. No, not really. Stimulus generalization, remember, is when a stimulus is generalized towards other stimuli that resemble it. So someone with, let's say, post-stress syndrome, post-stress PTSD, post-traumatic stress disorder, if at the time, for instance, let's say a woman was raped by a man with a mustache, if this was a very traumatic experience, well, it may come that the woman may eventually generalize her reactions of fears, not just to that man with the mustache, but with all people with mustaches. So that's called a generalized stimuli, or stimulus generalization. This is not what's going on here. In this case, the child looks up to her physician. So this is B, modeling. Yes, that's it. I mean, whatever the doctor does, and she looks up to the doctor, whatever the doctor does, the child will repeat that behavior. It's not shaping, because the doctor is not giving reinforcements to the child until the child does a behavior that the doctor wants the child to do. It's not imprinting, because I mean the doctor was not immediately available after the child was born, so as to imprint behavior on the child. And it's not learned helplessness, well, for the reasons that we covered in the previous question. Let's take a look at another question. Although a father spanks his child when she hits the dog, the child continues to hit the dog. So the child's hitting behavior is a result of A, punishment, B, negative reinforcement, C, positive reinforcement, D, shaping, or E, classical conditioning. This is a tricky question, because you would expect the child to stop hitting the dog after he receives a punishment. So eventually, I mean, actually, that's what the father is doing. The father is trying to punish the child so that the child will not keep hitting the dog. So how come that the child keeps hitting the dog after the child is after the child is punished? Well, it could be because it could actually be not properly punishment, but rather a positive reinforcement. Now you may wonder, but how is this positive reinforcement? I mean, how is the child being reinforced if he's actually receiving an unpleasurable response from the parent? Well, it could be the case that by spanking the child is interpreting this not properly as a punishment, but as getting attention. So in that case, his or her behavior is being reinforced by the parent. Now the parent may think that he's punishing the child, but the child may actually think that he's being rewarded by getting attention from the parent. So I would say that in this case, it's C, positive reinforcement. I mean, this is something that educators and you physicians always have to watch for, because other people may interpret what you may think that it's actually a punishment. Other people may actually think that it's a reward, that it's a positive reinforcement. So you have to make sense out of the punishment that you think that you're providing, and you have to consider whether or not it is being interpreted as such. Okay, and let's look at one more question. In the past, a child has on occasion received money for cleaning his room. Despite the fact that he has not received money for cleaning his room for the past month, the child's room cleaning behavior continues. That is to say that it is resistant to extinction. So this behavior is most likely to have been learned using which of the following methods? A, continuous reinforcement. B, fixed ratio reinforcement. C, fixed interval reinforcement. D, variable ratio reinforcement. Or E, punishment. Well, obviously it's not E, it's not punishment. I mean, people will keep doing a behavior when they're rewarded for it. Now keep in mind that the best way for people to develop habits and when they're receiving reinforcement is by not having a fixed or continuous reinforcement. So if every time someone does an action that they will be rewarded for, if every time they do it they will be rewarded either immediately or at a fixed ratio or interval, that has a greater risk of becoming extinct, because once the behavior is no longer rewarded, the behavior will disappear. Now in this case, the question tells us, or the premise of the question tells us, that the child, even after not having received money for a month, the child keeps cleaning his room. Now, how have the parents achieved this? Well, they have achieved this by using variable ratio reinforcement. So the child cannot predict when he will receive the money. He may receive it or he may not receive it. Now, in as much as he's not sure as to when he will receive the money, he keeps cleaning his room. This is the most efficient way of reinforcement of reinforcing behaviors with a variable ratio. And of course, as I said, this is the way that casinos work. I mean, when people go to the slotting machines, they cannot really predict when they will get the money, but that actually reinforces even more their going to the casinos. Now, that's a very destructive reinforcement. In this case, in the case of cleaning up a room, it's a constructive reinforcement. Okay, let's look at one more question. A 2-year-old child is afraid of nurses in white uniforms. When his grandmother comes to visit him wearing a white jacket, he begins to cry. So this behavior by the child is an example of A, stimulus generalization, B, modeling, C, shaping, D, imprinting, or E, learned helplessness. Well, I think here the correct answer is A, stimulus generalization. The child has a response to a specific stimulus, which is white uniforms. And whenever the child sees someone else with a white piece of cloth, then he will have the same response to that stimulus. So what the child has done there is that he has generalized the response to the stimulus. So it's a stimulus generalization. As I was saying, this is very similar to people who suffer from post-traumatic stress disorder. I mean, any specific stimulus may cause in them a response, a traumatic response, but eventually they may come to generalize that stimulus. So let's say that a woman was raped by someone who was wearing a mustache or something else, or something like that. Every time a woman, it could be the case, it's not necessarily like that always with these patients, but it could be the case that every time that a woman sees someone with a mustache, she may have generalized the response to that stimulus. So the stimulus may have been generalized. So every time she sees someone with a mustache, she has the same response. System of dogs. And he was very interested in salivation. As you probably know, salivation has an important physiological function in as much as it prepares the digestive system with all the chemicals needed in order to process the food that's going to be taken in. So salivation produces enzymes, and the enzymes will eventually break down the food so that it's processed through the digestive system. So every time an animal sees some piece of food, the animal will start salivating. And Pavlov wanted to study how these processes took place. But in the midst of doing these experiments and doing these studies, he realized something very interesting. And he came to see that the dogs he was studying salivated at the sight of their keeper. Not at the sight of food, but at the sight of their keeper. So they salivated in the absence of actual food. So Pavlov began to wonder, how can dogs salivate if they are not seeing food? And he began to think that, well, maybe it is that they're seeing not the food, but something that is associated with the food. And by making that association, they can eventually respond to a different stimulus that was originally associated with the original stimulus. So he devised a new way to perform a new experiment. And he said, well, look, every time a dog will be provided with food, we're going to make sure that we ring a bell, and we'll see what happens. So during this series of experiments, Pavlov provided the dogs with food, but immediately as he was providing the dogs with food, he would ring a bell. Now, eventually, he came to mental processes are really of no concern to psychology. Psychology should be exclusively concerned with behavioral expressions, because if we try to gather what's going on inside the minds beyond behavior, that's speculation, because we really have no way of knowing. So we should be concerned exclusively with behavior, and that's what's called the black box theory of mind. It's a black box because it's a mystery. We don't know what's inside. Some psychologists have criticized this, and they have said that, well, even if we can never be sure what's going on inside other people's mind, cognition, or the process of the processing of thought, is important. So psychology is not just about behavior, it's also about what people think, even if we may not be absolutely sure of what's going on inside other people's mind. So that's one of the first criticisms that has been leveled against behaviorism. But for the time being, let's keep up with the assumption of the black box theory of mind of behaviorism. So let's consider behaviorism where it all began. And it began with a series of very famous experiments by a very famous Russian scientist, Pavlov. And I'm sure that you've heard of this in the media because the phrase Pavlovian dogs is it's quite popular. A Pavlovian dog refers to someone or to a situation where people respond automatically or mechanically to a stimulus. So a Pavlovian dog is pretty much like a machine that receives inputs or receives stimuli and gives outputs or gives responses. And this goes all back to a series of very famous experiments that this Russian scientist did. So Pavlov was a Russian scientist that he wanted to study the digestive. Okay, today we're gonna pick up our previous lectures on psychological theory. This is a continuation of the behavioral science course we're following. In the previous lecture, we talked about psychoanalytic theory, which is one of the most famous theories in psychology, but perhaps it's not the one that that has had the greatest impact when it comes to the importance in the history of psychology. Behaviorist theory and learning theory are much more important when it comes to physicians and to psychologists in general. So today we'll pick up learning theory. And keep in mind that the U.S. physicians, you will also play a role as educators. I mean, one of your duties as physicians is to provide health care to people. But in order to do that, patients need to comply, and patients need to follow treatment, and they need to change their lifestyle, and they need to modify their behavior. And how do you get patients to do that? Well, by educating them. Now, education is not just about giving out facts, but it's also about changing habits. Remember when we talked in the first lecture about ethics, we learned that Plato said that those people that do not behave well is because they don't know what they're doing. And Aristotle criticized that, and they say, well, look, behaving well is not just about knowing facts, it's also about having the will to do things and about having habits. And I think physicians would side much more with Aristotle on this. And in order to change people's habits, you need to know some basics. The theory that works with this the most is behaviorist theory. As the name implies, behaviorist theory places a lot of emphasis on how people behave and how they change their behaviors. Nowadays, some people give it behaviorism a bad name. Probably you've seen in the movies how some behavior psychologists assume that people are machines or that they are animals, and that they can modify people's behavior with sticks and carrots, and that they treat people as if people were animals in an experiment and so on. But those are media stereotypes. I mean, it is true that some of the criticisms leveled against behaviorism, they are fair, but nevertheless, behaviorist theory is basic in psychology, and it has had a great impact in the history of psychology, and it is very useful for learning theory. So I think it deserves to be considered here, and I invite you to consider the importance of behaviorism with an open mind. So behaviorism begins with what's called a black box theory of mind. And this theory tells us that we can only observe behaviors. We don't really know what's going on inside other people's mind. And that's why it's called a black box. I mean, it's a mystery. I'm not in your mind to see whether or not you're enjoying this lecture. However, I can observe your facial expressions. And from that observation, I can make the inference of whether or not you're actually enjoying this lecture. It would be nice to read other people's thoughts, but so far we don't have the technology, and I'm not sure that we'll ever have the technology to do so. So behaviorists say that, well, look, of learning theory, how do people learn in order to persuade them to change their behaviors? So keep in mind that you as physicians are educators, and that I mean, you're not educators as teachers or professors, so maybe you need to know the basics of how people learn facts, or how memory works and all of that. But you do have to learn how to what techniques you must use in order to change a patient's behavior. Because remember, as we learned in the doctor-patient relationship, and the lecture on the doctor-patient relationship, um, there is a risk always in the doctor-patient relationship that the patient will not comply. So by learning the basics of learning theory, you can increase the chances of the patient complying. Remember, also keep in mind that all of these topics will probably appear in the USMLE Step 1. So at the end of this lecture, we'll do some review questions with questions that resemble the ones that appear in the USMLE Step 1. So let's begin. So let's consider what learning is. Well, learning is the acquisition of new behavior patterns. And we're defining here learning in a broader sense. I mean, people may think that learning is just about getting facts and memorizing them, or understanding them, and analyzing situations and so on. And certainly that's a part of learning, but that's the cognitive aspect of learning. But you as physicians are more concerned with the behavioral aspect of learning. So here we're more concerned with learning as the acquisition of new behavior patterns, not so much as the acquisition of cognitive information. And the